Hello, future doctors, and welcome to Bedside Clinics. If you've ever felt that little bit of panic when you see a swellings case on your OSCE list, you are in exactly the right place. Today, we're going to make it all so much clearer. We'll break down the 5 most common swellings cases you're almost guaranteed to face in your final exams. The goal here is to give you that pattern recognition and confidence you need to just ace it. So, let's get started. All right, picture this. You walk into the exam room, the clock is ticking. There's a patient with a swollen knee. Where do you even begin? What are the first questions you ask? It's that moment of panic we want to get rid of. We're going to replace it with a clear, step-by-step approach that'll guide you straight to the diagnosis, every single time. So we're about to run through 5 classic presentations. What I want you to do is focus on spotting the patterns in each one, because once you see those patterns, you'll be able to narrow down your options so much faster, even when you're under pressure. Let's dive into our very first case. Okay, look at the story this slide tells us. We have a young man, there was a clear history of a fall, and then, this is the key, sudden swelling. That word sudden should make you think of one thing. Swelling that pops up within a few hours of an injury is almost always blood in the joint, which we call haemarthrosis. And your big clinical sign? The positive patellar tap. That's where you push on the kneecap and feel it tap against the femur below. That confirms a lot of fluid. And of course, it's painful, which is why the patient can't bend their knee very well. It's a classic picture. Now let's compare that to our second case. You can see right away it's a completely different story. There's no obvious injury. Instead, our clues are systemic. You've got a hot, red, incredibly tender joint, and the patient has a fever. This combination should be screaming infection at you. This is a real orthopedic emergency, and notice the timing. Unlike haemarthrosis, which happens in hours, this usually develops over a day or two. Case number 3 is another big shift. Let's break this one down. Here, it's all about the timeline. This is a chronic problem, something that's been going on for a while. The swelling is described as painless and cold, which just means it doesn't have that heat and redness we saw in the last case. When you see a presentation like this, especially with symptoms that affect the whole body, like weight loss and maybe a little opening on the skin draining pus, that's a sinus, you have to think of a chronic infection. And the classic cause here is tuberculosis. With our fourth case, the most important clues come from what you feel and the kind of pain the patient has. When you actually palpate this swelling, it feels bony hard. It's not squishy or fluid-filled like an abscess. The edges are hard to make out, they just seem to blend into the bone. But the biggest red flag, and I mean a huge one, is the night pain. Pain that is so bad it wakes the patient up from sleep. When you see this combination, especially in a young person, you have to be very suspicious of a malignant bone tumor, like an osteosarcoma. And finally, our 5th case. For this one, you need to zoom out a bit and look at the bigger picture. We have multiple, small, firm swellings, often over places like the elbow. But the clincher is the rest of the history. The patient complains of really significant morning stiffness that lasts for over an hour, and you can see other joints are deformed. See? This isn't just an isolated swelling. It's a sign of a body-wide inflammatory disease, and the most likely culprit is rheumatoid arthritis. Great, you've seen the patients, you've got your initial ideas, but the OSCE isn't over, is it? Now comes the Viva, where the examiner really tests if you know your stuff. So let's get you ready for some of those classic questions. Now, this is a bread and butter question. You'll get this one a lot. The examiner is checking if you can compare and contrast 2 very common, very acute presentations. So take a second. How would you structure your answer? The best answers are always structured. You want to compare the key features directly, side by side. Start with the history. Well, in a traumatic swelling, there's a clear history of injury, whereas in an infective one, there usually isn't. Then talk about the onset, hours for trauma, days for infection. And finally, the clinical signs, a tense swelling without a fever versus a hot, red, tender joint with a high fever. This shows the examiner you're thinking clearly and logically. Okay, let's say the examiner wants to follow up on case 3. They might pick up on a specific term you used. They want to know, do you really understand what a cold abscess is? The answer is really in the name itself. It's an abscess, meaning it's a collection of pus. But it's cold because it doesn't have those classic fiery signs of acute inflammation. So no intense heat, redness, or severe pain. And when we're talking about orthopedics, the #1 cause you need to mention is skeletal tuberculosis. All right, now for a red flag question. This is all about patient safety. The examiner has to be sure that you can spot a condition that could be life-threatening. So what were those features from case 4 that point towards a malignancy? Your answer here should just be a clear, concise list of these red flags. You want to mention the young age of the patient, that deep, nagging bony pain, and specifically the night pain that wakes them up. Then on examination, you'd mention the bony hard feel, the fact that it feels fixed to the bone underneath, and those ill-defined edges. You absolutely have to memorize this list. And for our last question, this is what we call a synthesis question. You're given 2 key findings. The examiner wants to see if you can connect those dots to come up with a single diagnosis that explains everything. Yes, the diagnosis here is rheumatoid arthritis. That specific combination, multiple nodules under the skin, plus that really significant prolonged morning stiffness, is just a textbook presentation of this systemic disease. You've done great. We've gone through the cases. We've tackled some tough Viva questions. So now let's just pull it all together into the core principles that you can carry with you right into your exam. Just remember these 5 patterns: Haemarthrosis, septic arthritis, a cold abscess, osteosarcoma, and a rheumatoid nodule. I promise you, if you can really get comfortable with recognizing these 5 conditions, you will be able to handle the huge majority of swelling cases that they can possibly show you in an exam. So this is your mental checklist. For any swelling case you encounter, just run through these steps. 1. Start with the history. Was there trauma? Yes or no? 2. Look for systemic signs. Does the patient have a fever? 3. Examine it. What does it feel like? Is it hot, cold, hard, or soft? 4. Think about the timeline. Did this happen in a few hours or over a few months? And 5. Put it all in context. Connect that one swelling to the whole patient sitting in front of you. And there you have it. That's a solid framework for the 5 most common swelling cases in orthopedics. In our next session, we're going to build on this foundation and do a deep dive into the broader differential diagnoses of swelling. If you found this session helpful, please do give it a like. If you have any questions or doubts at all, just drop them in the comments below. And of course, make sure you subscribe to Bedside Clinics for more practical OSCE prep. Keep studying hard, and I will see you in the next one.